this short video is just talking about the reasons why you might experience pain after you've had a steroid injection. The first and probably most important reason to consider is extremely rare, probably one in about every 100,000 injections, but it's one that we must flag up the importance of, is a possible infection. So an infection could be introduced at the time of the injection. It can be with any invasive procedure. Normally, the person would experience sort of red, hot swelling around the site of the injection. Typically, they will also feel unwell, feel nauseous, start to spike a fever. This is a medical emergency, and if you've got any concerns that you might have an infection after a steroid injection, you must go to A&E and you must show them where you had the injection and obviously your concerns. So that is a medical emergency and must always be treated as such. But just to reassure you, extremely rare. A far more common reason why people experience pain after injection, and almost always the reason why we might get contacted by patients or called by patients, is post-injection flare. So we know that steroid can cause a bit of irritation when it's first introduced into the soft tissues or into the joint. For the vast majority of people, this will last just a day or two and will just give them a slight increase in their pain levels. In a much smaller cohort of patients, it may go on for a few more days and be a slightly increased level of pain. There is, again, a very rare scenario which is predominantly associated actually with hyaluronic acid injections rather than steroid, but we mention it here also, and this is pseudosepsis. So this presents like an infection, so severe pain, can be some red, hot swelling around the joint, but it isn't actually an infection. So you go to A&E or go to the hospital, they'll check you, they'll conclude there isn't an infection, and this is known as pseudosepsis. Again, I say this is extremely rare, but just flag this up because it is important that it's managed appropriately. So the next reason why you may experience some pain after the injection is needle trauma. So obviously when we perform the injections under ultrasound guidance, we're able to see all of the major structures, and obviously we take great care to make sure that we don't go anywhere near vessels, arteries and nerves with the needle. But sometimes there can be very small nerve endings which are almost impossible to see even on ultrasound. And if these get irritated or traumatized by the injection, these can cause pain, a discomfort that may last for a few days afterwards. The best thing to do here is to just contact the clinic. We're always happy to review and just check over and make sure everything's okay. This can oftentimes be done over the telephone. On again, rare occasion, we may ask you to come back into the clinic just so we can check you over. Another reason why we may experience pain after an injection is a tendon injury or fascial injury. So as we mentioned with the nerves and vessels, we take every care to ensure that we do not injure or traumatize tendons or fascia when we're performing injections. Sometimes, however, there can be a small amount of trauma to the tendon, particularly if the tendon is already tendinopathic. So in other words, the tendon isn't as strong as it normally would be. So then introduction of a steroid close to it could lead to a small injury or trauma to the tendon. Again, we would always be very happy to speak to patients and review patients if there are any concerns that a tendon or fascial injury has occurred. So another relatively unusual, but a reason why people may experience pain following an injection may be an allergy to one of the implements or materials that were actually used during the injection. So some people actually have allergy to the needle, so a nickel allergy. It's unusual, but can happen. So a lot of our patients already know that they have a nickel injury, but obviously some may not. Some people may have an allergy to some of the wipes and sprays and sterilizing equipment that's used. And occasionally, some people have allergies to the plasters. Again, oftentimes patients know that they're allergic to elastoplast, and we use plasters that are much less likely to cause an allergic reaction. But this can happen from time to time. Again, if you've got any concerns, if you're coming out with a rash, or there's any signs of any allergies around the injection site, then just contact us and we'll be very happy to speak to you about it and review. So the purpose of this video is just to give an overview of some of the reasons why people can have some pain and discomfort after the injection. Just to clarify that the vast majority of cases is post-injection flare, which is completely safe and settles down usually after a short period of time. All the other reasons are generally very rare, so they happen very, very rarely. But it's important, if you've got any concerns with the infection, you must go and get this checked over and get medical review immediately. And if you've got any concerns that there may have been an injury or that you may have a localized allergy to the injection, just contact our clinic and speak to the clinician. They're always very happy to review, provide reassurance, and obviously help you in any way they can with any concerns that you may have.